All right, so with that, I'm going to move on to Tom, and it's so nice to have you here today. Tom and I are actually both part of a senior advocacy council where a number of senior businesses get together and network on how we can better serve people. And recently, I had the opportunity to hear his personal story, which was just really, really compelling. So, before we get into that, tell us a little bit about you know, what your company does and what brought you to starting that company in the first place.
Yeah, so I'm going to try to make a long story short and summarize the last 11 years of my life. But at Ride Your Way, our mission is to remove barriers that prevent people from living their best life. And we do that by empathetically providing a way for people to access the world. So we have a fleet of we're going on 25 vehicles now with two different offices, one in Grand Rapids and then also one in East Lansing. And we provide transportation for individuals who have mobility challenges if they're utilizing a wheelchair, or individuals that just need a little extra assistance. They can get in and out of a vehicle, but might just need an extra helping hand to get to and from doctor's appointments. We also do non-medical outings, weddings, family events, open houses are huge in the springtime, date nights, whatever it might be, we're able to assist individuals to and from those events. Um, so to kind of share a little bit more about my story personally, back on May 14 of 2013, so we're coming up on 11 years now, I was diagnosed with a rare type of pediatric brain cancer. So I was, again, 17 years old at the time. I was sitting in my chemistry classroom, and it was the absolute best excuse to get out of chemistry. Um, I had an appointment. I was having some mental health issues, which was very unrealistic and really out of character for me, out of nowhere. And so found myself at an outpatient clinic, was evaluated. 5 minutes later, the psychologist said, "Hey, this doesn't seem right. I think you need to go to your pediatrician." So we took a quick trip down the road, went to my pediatrician's office. He evaluated me and said, "Yeah, let's go down to Helen DeVos and get a scan done." So again, another hour later, I was sitting inside of a CT machine in the emergency department at Helen DeVos, and it's never a good thing when the doctors come in and say, "Hey, we're going to get an MRI done." So I had an MRI done again another hour later, and by about 6 o'clock that night, I was diagnosed with cancer. So I underwent a pretty intense brain surgery, 4 rounds of inpatient chemotherapy, and then 5 weeks of outpatient radiation over about a 7 month time span. So really ruined a lot of my summer plans, but so that whole experience in my life, I was exposed to the healthcare industry, all of the nurses, doctors, support staff that took care of me at the Children's Hospital was absolutely incredible. Kind of a side note, it's pretty incredible that we have as much as we do here in Grand Rapids, where we were getting consults from hospitals all over the world, MD Anderson, Mayo Clinic, and everybody said that the best place that you can possibly go is 15 minutes away from your house. So through all of that, I again saw, I have a huge love for the healthcare industry and especially nursing. So being 17 years old, I was trying to figure out what the heck I wanted to do with the rest of my life. And, spending a lot of time at the hospital, decided that I wanted to become a registered nurse. So after that, went to nursing school at Grand Valley, and 4.5 long years later, became a registered nurse and worked on the same floor that I was actually treated on. So worked alongside of the oncologist that was taking care of me, a lot of the nurses that also took care of me, and got to experience healthcare from not only inside of the bed but at the bedside as well. Backtracking a couple of years, while I was going through nursing school, started to see that a lot of the patients that I was taking care of at the hospital during clinicals were having issues getting from their medical appointments. And a lot of these individuals have chronic illnesses that need really good control, but just because of that transportation barrier, they weren't able to access those healthcare services they really needed. And so I love driving, always loved driving, and started to kind of put the pieces together and started to do some research about other transportation options outside of like the rapid public transit, go bus, stuff like that, and started to see that the transportation companies that were out there were either EMS companies that were charging $2,000 to $3,000 to get to your doctor's appointment, or there were small companies that really weren't providing a high quality transportation solution. So it wasn't really solving any issues. It was poor quality, poor on time performance, weren't getting you to where you needed to be, and just kind of started thinking there's a better way of doing this. And that's really how Ride Your Way started.
Gotcha. So it really is, there's a critical relationship into people being able to get treated with these chronic illnesses and just that idea of getting from point A to point B.
100%. And then outside of that, why do we go to medical appointments? Why do we want to be healthy and live a long life? It's because of everything that happens outside of those doctor's offices. So spending time with family, spending time with friends, getting to enjoy all of the really cool stuff that's going on here in West Michigan. And, we're doing a disservice to the community not providing a way to access all of that.
Yeah, I agree with that because just in the stories that we've heard today and from Omar in terms of that idea of we understand that all of you and your family members and your parents, your grandparents, you have places that you want to go. And it's can be very challenging with that thought of no longer having the independence to take yourself there. And how do we provide safe alternatives so that all of you can still continue to live active, enjoyable lives, getting where you want to go, and yet have it be done in a safe way for all of you and the community. So, what are some of the types of drives that make up the bulk of your business? I know you touched on some a little bit, but what are other services that may not be common, but that you are able to provide when needed?
Yeah, so we specialize in medical transportation. So bringing individuals who might utilize a wheelchair or another assistive device like a walker or a cane to and from doctor's appointments. We also transport a lot of the rides that we do are to and from dialysis, cancer treatments, outpatient clinics, whatever it might be, truly any medical necessity we're able to transport to. I often say we transport to anything that doesn't require lights and sirens. So EMS has its place. I don't want to get into that. They're incredible people, and we have 2 incredible companies, 3 incredible companies in the area that provide that type of service. But for anything that's non-emergent, that's where we kind of step in. Outside of that, again, like I said, the non-medical outings is also a large part of what we do. Because a lot of the companies here in the area will only transport to medical necessary treatments, and then there's often a service area radius around that that's pretty restrictive. So we operate across the state of Michigan. The furthest transport that I've done personally, discharge somebody from Corwell Health right in downtown all the way up to Marquette. Life. So getting that individual home in a timely manner in the highest quality way, that's what we're here to do. So we kind of have a motto within the office. There's never no, it's just yes, this has to be true in order to. So whether it's a medical appointment, non-medical outing, no matter what barriers are currently in place, it just requires a discussion to remove those barriers and help people access what they need to.
Great. So I got the first taste of what it was like years ago to have to transport somebody who required a wheelchair. And there's not a lot that scares me, so I'm always like, oh yeah, I can do that. And yet it was really, really challenging and more challenging than I thought to be able to get them in and out of the vehicle safely and making sure that I got them from the seat to their wheelchair and so forth. So what are some of the things that help family members to get over that learning curve of being able to transport people, and where that line is where family is probably in over their heads like yours?
Yeah, so it all comes down to how comfort, a family member is with assisting in that transfer over, let's say from a wheelchair into the back of a sedan. And it all comes down to, again, safety, not only for you all or the individual that's being transported, but also for that family member too. With picking up and having to pivot into the vehicle, there's not only the risk for the individual doing the transfer hurting their back or another part of their body, but also from the client standpoint, possibly getting dropped to the ground, or again straining their back too because you're trying to essentially throw them into the back seat. And then from the transportation provider's perspective, there's a lot of safety considerations too. So we've got incredible vehicles with safety devices inside that help, if somebody is utilizing a wheelchair, help them lock them down into that vehicle safely in a way that, if there was a side collision or front collision, they're, being safely transported in that vehicle. From the transportation provider as a whole, what you want to look out for is what types of policies, procedures, and core processes are these companies using to train their individuals? What types of accreditations or certifications do they have in order to do business in the state of Michigan? And are they doing it to the best of their capability? So no transportation providers the same. We try to go above and beyond just because of my experience and the type of service that we want to provide. All of our drivers are first aid CPR certified. Everybody gets background checked, motor vehicle record, drug test, DOT physical, and then they go through quality and safety training for a number of weeks. So we want to make sure that we're overkill on the training side, so that way when we're assisting our clients, it's to the best of our capability. There's also a newer accreditation that not many people know about within the industry that is really setting the best practices and standards for transportation. And so we at Ride Your Way, we're the first company in Michigan and 11th in the nation to achieve this national accreditation. So I'm obviously the most biased guy in the room, but nobody really quite does it the way we do it. And again, it all boils down to safety. So I never personally, I always put myself back in that bed, back at that bedside, or if I was transporting my mother or father or loved one, I never want to put anybody in the position that we're jeopardizing safety for the green stuff at the end of the day. And I want to make sure that, again, our mission to remove barriers, we never want to put more barriers up. We want to just keep breaking them down.
Awesome. That sounds great. So, of course, life is super expensive. I just got my first water bill that was over $500 and I about choked. So, people make decisions, obviously, a lot based on cost. So, can you talk a little bit about how do people pay for your service? Is any of it covered under insurance? And what type of range could they expect?
Yeah, so we do everything that we can to bill insurance. I never want to pay, or I never want anybody to have to pay out of pocket for our services. So the nice thing about a lot of insurance plans now, they're starting to benefit as not only for medical necessity, but also non-medical. So if it's going to like a day facility or even there's a lot of updates in the Ohio market where people are even being transported to the grocery store, and I did hear a rumor of people actually going to the casino too. So life enrichment activities are extremely important. So there are a lot of insurance companies that are covering non-emergency medical transportation now, not just those $4,000 ambulance bills that come in every once in a while. We have a really good finance department that tries to do as much work on the front end to give you that peace of mind. So whether it's, facilitating a conversation with the insurance company or walking you through the process on what questions to ask if you're looking for new insurance or talking to a provider trying to see if you can get coverage. And then at the end of the day, if your insurance company doesn't cover medical transportation for our services, we want to set you up for success. So if it's with another company, kind of help facilitate that process too. Auto no fault is a huge pain in the butt for transportation that we've been trying to navigate, and so we've opened that up as well. And then we also work with 70+ skilled nursing facilities, continuing life communities across the state. So a lot of them will actually have a budget put aside for transportation too. So we can contract with those facilities directly as well and bill them for services. We're also launching a new loyalty program, which the last point we'll talk about, but to make transportation more affordable and really reward the individuals that are utilizing our services day in and day out. We want to make the overall experience better and also decrease the cost overall.
So what might a typical trip cost, range-wise?
Yeah, so it depends on the distance of the trip. So if we're looking at like a hospital discharge, those start at $50. And then as you go further out, there's a mileage cost as well. So I would say on average, our average cost per ride is about $66. But I mean, if you're looking at, even a non-emergency transport with an EMS company, you're upwards of $200 to $300. I actually did quote out, we assisted with a ride about 2 weeks ago where an ambulance was going to transport somebody about 60 miles and it was going to cost about $4,500. And it was like the highest level of service that we do, and it was going to be about $300 for us.
Wow, that's a big difference. And one of the things too, I just want to think about, obviously owning a vehicle in itself is very, very expensive. And for somebody who might say, well, gosh, a ride can be expensive at $60, if you are ready to forego the cost of owning a vehicle and then use it towards paying for safe transportation, I think that in the end, the cost would very much offset itself.
Mm-hmm. Yep, in our finance team, our director of finance is also my younger brother. So it's a family affair. I've got my younger brother and sister working within the company. So he hates spending money. He doesn't want our clients to spend money either. So he'll walk through that process with everybody and make sure that we're providing that service and not breaking the bank either.
Well, and I just wanted to say, I love that if you go on the website for Ride Your Way, there are pictures of all of his drivers, the stats on the miles that they've driven, and really a very large description and detail of your company values, which to me just says a lot.
Yeah, and it all goes back, I sound like a broken record, but it all goes back to me being in that bed and me being at that bedside. So our core values are always be wholehearted, so always do the right thing for the betterment of our community and the people that we're serving. Clear, concise communication, because when communication breaks down, bad things happen. And then just be a good person. Like that's at the core of what we're doing here. It's all about just being a good person, shining a little bit of light on somebody's day, especially when we're transporting somebody to, let's say, dialysis. We're building those relationships with people because we're transporting them 3 days a week. And it might be 15 minutes per ride, so you're going there and back. You're spending a half an hour a day with somebody that often goes unlooked, and you're just looking at orange cones going by as we're driving down 131. But building a friendship with that person, providing a different level of care that it's not medical, but I truly believe that what goes on between the ears has a big part to do with medical outcomes, and so just being somebody that can be a hearing ear and provide some support during a difficult time is really what we're trying to do. And we transport anywhere from like 180 to 200 people a day all over the state. So, you know, that's a lot of barriers that we can remove and a lot of lives that we can change. That would often, you know, again, like I said, at miles that, you know, we're just going by looking at phones. So we want to make it a different experience for everybody and really try to make a positive impact in the community by providing a different level of transportation.
Great, awesome.